हेलो गुड मॉर्निंग, मैं से डॉक्टर आर्यन और आज हम डिस्कस करेंगे मेडिसिन के पास्ट ईयर क्वेश्चन पेपर। एन 18-year-old गर्ल विद द डायग्नोसिस ऑफ एक्यूट प्रोमाइल्यूटिक ल्यूकेमिया was treated medically. She developed fever and tachypnea, and a chest X-ray showed pulmonary infiltrates. What drug should she be given next? Citabine, dexamethasone, doxorubicin, and methotrexate. Here the best answer is the dexamethasone. Why dexamethasone? Because those clinical scenario described a patient APL, acute promyelocytic leukemia. What developing what? Fever, tachypnea, pulmonary infiltrates. And while on medical treatment, if the suggestive appear differentiated syndrome and adverse effect of all transretinoic acid, the management involves glucocorticoids or dexamethasone. And what we can use for among the glucocorticoids, the other management of APL differentiated syndrome includes chemotherapy for cytoreduction and supportive measures in severe cases like temporary discontinuation of ATRA if is necessary. Next question. The definition of fever of unknown origin FUO includes all of the following except undiagnosed after 1 week of investigation. This one is the right answer, because the current fever definition is the fever of unknown origin does not include undiagnosed after 1 week of investigation. The criteria for diagnosis, if uncertain after 1 week of evaluation, which are previously a part of what definition with the removed. FUR is currently defined as fever more than or equal to 38.3 degree Celsius or 101 degree Fahrenheit at least two occasion duration होना चाहिए of more than or equal to 3 weeks. No known immunocompromised state. Diagnosis is uncertain after through history taking, examination and obligatory investigations. Next question. A 43-year-old patient presented with spikes of fever and difficulty in breathing. Transesophageal echo revealed vegetation in the heart. The culture was positive for Burkholderia cepacia. Which of the following is the first line of management? Aminoglycoside and cholesterol, cotrimoxazole with third generation cephalosporin. This one is the answer, because the first line of agent used in the management of Burkholderia cepacia, complex BCC infection है ये, with the cotrimoxazole we use is the timethoprim. Sulfametazole is used by the cotrimoxazole or minoxidil and ceftazidime, third generation cephalosporin. Next question. All are component of CURB65 except confused state नहीं, respiratory rate of more than 30 नहीं, blood urea nitrogen value greater than 7 mmol not, systolic blood pressure less than 100 mmHg. This one is the answer, because here among the given option the systolic blood pressure is 100 mmHg. Is not a component of CURB65. CURB65 include systolic क्या क्या इंक्लूड करता है? सिस्टोलिक लेस देन 90 mm हो और डायस्टोलिक 60 हो, 60 mmHg और CURB 65 criteria is used for access what? Severity of illness, severity of illness. In case of community acquired pneumonia, it includes confusion if urea more than 7 mmol, respiratory rate more than 13, blood pressure systolic 90 mmHg, diastolic less than 90 mmHg, of age कितना होना चाहिए? more than equal to 65 years. Pneumonia severity index is another index to what the access the severity of the illness and the risk of the mortality. In case of the pneumonia, it included 20 variables, and depending on the score, patient are assigned into the 5 classes. Class 1, 2, 3 at low risk of death can be treated on the outpatient basis. Class 4 and 5 require hospitalization. Class 4 and 5 require hospitalization. Class 1, 2 and 3 at low risk of death, low risk of death, and can be treated in outpatient basis. Next question, a 22-year-old female patient came with complaints of vomiting and a decrease in movement of the right leg. In the past, she has had episode of violent and aggressive behavior and abdominal pain. Which of the following is the most probable diagnosis? AIDP with migraine, right side paralysis, acute intermittent porphyria. This one is the answer, because here the clinical scenario described decrease in the movement, decrease the movement of the right leg, means यहाँ पे क्या रहे? न्यूरोलॉजिकल सिम्टम. इसका सिम्टम इन अ यंग फीमेल विद द हिस्ट्री ऑफ व्हाट? एपिसोडिक अटैक ऑफ एब्डोमिनल पेन एंड एग्रेसिव बिहेवियर. मीन्स एग्रेसिव बिहेवियर मीन मेंटल सिम्टम्स आ रहा है. इज कंसिस्टेंट विद द डायग्नोसिस ऑफ द क्या? एक्यूट इंटरमिटेंट porphyria. So this one is the answer. Next question, a 36-year-old male came with complaints of ascending weakness in both lower limbs and upper body. There was no history of trauma. Which of the following investigation is done evaluation in this patient? Serum potassium is the best, because here we give the clinical scenario the ascending prophylaxis among the serum potassium, because if that is tested or disturbance is serum potassium levels, what? Hypokalemia seen, hypokalemia or hyperkalemia also seen, present with what? Ascending muscle weakness. प्रेजेंट क्या करेगा ये? असेंडिंग मसल वीकनेस. Muscle weakness. So this one is the answer. So that's all, and thank you and keep watching.